today we are going to discuss about liver and its associated problems. And as you all know, every year we celebrate the World Hepatitis Day on 28th of July. And as the Hepatitis Day approaches, we try to educate the public on the importance of the liver and its associated problems. Liver is one of the most important organs of the human body. It is also one of the biggest organs, and it consists of two lobes, the right lobe and the left lobe, and it performs innumerable functions. Namely, it takes part in carbohydrate metabolism, fat metabolism, protein metabolism, synthetic of certain substances which are done only in the liver, namely albumin, a type of protein which is very essential, and then it synthesizes what is known as prothrombin, which controls the coagulation of the system. Apart from this, the liver takes part in also the immune system, which is known as the immunological aspects of the liver function. It takes place of detoxifying, namely it destroys all the bad substances in the blood. It also destroys or degenerates some of the drugs what we take. They go to the liver for elimination. The two important organs which take part in elimination of substances is one of the liver, other is the kidney, and some of the things the liver takes part in clearing off these drugs. The other important thing is the liver takes part is in destroying the damaged RBC, red blood cells, and they only produce what is known as bilirubin. Now this bilirubin, after it is cleared by the liver, it comes out in the urine. Now, what are the functions? What are the symptoms of liver disease? Now, liver, when the liver gets inflamed, it is known as hepatitis. Now, the cause for hepatitis are many. But what are the symptoms of hepatitis? What people are usually telling is, they come to you with jaundice, that is yellow eyes, yellow skin, yellow urine. So, this is this thing. Along with this yellowness, we also get patient will have loss of appetite. They will not be able to eat well. Some of them will develop vomiting, nausea, and a few of them will present to you with abdominal pain. So these are the characteristic symptoms of liver inflammation, that is namely hepatitis. Now what causes hepatitis? Now we categorize hepatitis into two types. One is acute hepatitis, other one is chronic hepatitis. Now acute hepatitis causes are mainly viruses. You have A to E, A, B, C, D, E. Next you have got alcohol, which also causes acute hepatitis. Now we have other things known as autoimmune diseases which can cause hepatitis, and then you also have got what is known as metabolic liver disease. That is, earlier we used to call it as non-alcoholic fatty liver, that is fatty liver. Now we have got further category known as MASH, then you have NASH, and then you have, that is NASH means non-alcoholic steatohepatitis, wherein the liver gets inflamed, and this can progress on to chronic liver disease. And then you have got what is known as congenital diseases which can cause hepatitis, and then you have other metabolic diseases like Wilson's disease, hemochromatosis, all can produce liver problems. Now of the viral hepatitis, the commonest which causes acute hepatitis is virus A and E, which is transmitted by contamination of water. So it is waterborne disease. Whereas B, C and D, they are all transmitted in the blood as well as by sexual intercourse. So they are all diseases which can cause chronic liver disease. Anything which goes beyond 6 months, we categorize them as chronic liver disease. Now, acute hepatitis is treatable. You give them the patients, you have to put the liver on rest, namely, you have to put the patient, if they have no vomiting, we can give them liquid diet, soft diet, without fried things, without non-veg, give them some supportive liver enzymes, liver protein, drugs, and they improve. Usually within 2 weeks or 3 weeks, maximum 3 months, they will all be cleared. Whereas you have chronic liver disease, which is beyond 6 months, and the commonest cause is, as I told you, B, C, D virus. Alcohol is the main category, and then you have got what is known as autoimmune disease, which can go for chronic liver disease. The symptoms of chronic liver disease are, they will have jaundice, they will have fluid in the abdomen known as ascites, they will have swelling of the feet known as edema, they will have reduced urine output, then they can present to you with anemia, they can present to you with blood vomiting, black motions. So these are symptoms, or they can also have sometimes pre-coma, that is altered sensorium, they will not be able to orient themselves, or they can go for coma. So these are the symptoms of chronic liver disease. Now on this World Hepatitis Day, we are mainly targeting people to have a healthy liver by going up for regular checkup and to have treatment for the preventable aspects. For example, you can have prevent fatty liver from coming. Now we have got excellent drugs. Sarglatazole is available, 4 milligrams, and we give the patients who have this NASH as well as NAFLD, and usually it prevents the liver from going in for chronic liver disease. Viruses, can we have vaccines available for B virus? We can give this. For A virus also vaccine is available. So vaccination can prevent this particular category. Alcohol is all your lifestyle disease. You can prevent taking alcohol. It's easily preventable. You taking alcohol, definitely your liver will improve. So friends, on this World Hepatitis Day, let us make it a resolve to have a healthy liver by 1. Changing your food habits, avoiding things which will damage the liver, go for fatty liver, take some drugs to prevent NASH, that is non-alcoholic steatohepatitis, hepatitis going in for what is known as chronic liver disease, which we call it as cirrhosis. Have vaccination so that you are protected from B virus, you are also protected from A virus. Avoid alcohol, and then friends, have periodic checkups. A master health checkup will be able to detect all these things, and by doing all these things, you can have a healthy liver, have healthy food, you will enjoy life and live life to its full extent. Thank you.
VS Hospitals. Care, cure and compassion.